Please could you take deep breaths with your mouth open.
Repeat auscultation on the back. Again, compare mirror image positions left with right and listen at all the standard positions to ensure you don't miss a localized abnormality. As well as breath sounds, you may hear added sounds. The most common are crackles, wheeze and rubs. Crackles are interrupted non-musical sounds and can result from a number of different pathologies. Concentrate on when they occur in the respiratory cycle and their character, whether fine, medium or coarse. Sometimes added sounds can be due to bubbling in large airway secretions. If you suspect this, remove your stethoscope and ask the patient to cough. Secretions in larger airways will be cleared. Crackles caused by disease of the bronchioles or alveoli will not be affected. Wheeze has a musical quality and implies airway narrowing, for example asthma or chronic obstructive pulmonary disease. Time the sounds in relation to the respiratory cycle. Wheeze tends to be louder on expiration when the airways are narrowest. Inspiratory wheeze implies severe airway narrowing. The loudness of the wheeze is not useful in determining the severity of airway obstruction. With severe bronchospasm, the chest may be silent.
Each time I put my stethoscope on your chest, please could you say 111?
111. 111. 111.
Remember, increased vocal resonance indicates abnormally good sound transmission through consolidated or scarred lung. The other added sound that you may hear during auscultation is a pleural friction rub. This is a creaking sound similar to that produced by bending stiff leather or treading in fresh snow. It is produced when inflamed parietal and visceral pleural layers move over one another. A rub is best heard with the stethoscope diaphragm. It may be heard only on deep breathing at the end of inspiration and beginning of expiration. A pleural rub is normally associated with pleuritic pain and may be heard over areas of inflamed pleura in pulmonary infarction, vasculitis or pneumonia. If the pleura adjacent to the pericardium is involved, a pleuropericardial rub may also be heard. Pleural friction rubs disappear when an effusion separates the pleural surfaces.
Thank you.